onboarding, I make sure I have just a couple minutes to always just stress how medical necessity is really important for billing and coding. The diagnosis codes, the ICD-10 codes, should directly support the need for the visual field tests. Every visual field test must be medically necessary, of course, for it to be reimbursed by your insurance carriers. This means there has to be a clear clinical reason for the test was performed, and it cannot be a routine screening unless there's a specific indication. If a patient's coming in with 20/20 and no really cheap complaints or anything like that, it's not really routine screening to do a 24/2. Patients that are at risk for glaucoma, maybe you're monitoring a known condition, or patients with symptoms that suggest neurological issues. These should directly support the need for the visual field test that you're administering. And you want to document your procedures to mitigate audit risk. Relative to reimbursements, documentation is your primary defense in an audit. Every visual field report in the patient's chart must include these things. One is the reason for the test. You need a clear indication for the medical necessity of the test. You have to link it to the patient's chief complaint, their diagnosis, or a follow-up plan. An example of this may be the patient presented with an elevated IOP, test aims to rule out glaucoma. Number 2 is the test type and parameters. You want to specify the exact test that's performed, whether it's a VR visual field 24-2 or any type of test. You want to specify what test you administered. Third, you want to let us know who administered the test. You can include the name or the initials of the technician, but we need to know who administered the test. You need to talk about the reliability indices. You want to note these are highly crucial. You want to include and comment on the indices, for example, your false positives, false negatives, the fixation losses. Unreliable tests, though they were performed, they may not be reimbursable. You need to either justify why the test was unreliable and why the test, couldn't be repeated, or you need to show some type of attempts to retest. And then lastly, you need the interpretation and reports. This is the physician's or the provider's professional component. And this in itself has to include when the provider reviewed the results, a statement comparing the current results to previous results. You want to note the stability, improvement, or progression of whatever you're following, how the visual field results correlate or don't correlate with other clinical findings. You need a clear statement on how the visual field results influence the patient's diagnosis, their treatment plan, or their follow-up schedule. This is really vital in demonstrating the test's medical necessity. And then you need to sign it, of course.